There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, is a blood pressure of 160/90 high? Answer by Bruce McFarland. Yes. Remember, normal blood pressure is 120/80. Higher than 140/90 and the use of blood pressure medicine might be considered. In between these two, lifestyle modifications will be suggested. When measuring one's own blood pressure, try to be consistent about the measurements. Record the blood pressure in a log and also any circumstances that may affect the reading. Examples: finished big breakfast, took walk, argued with wife. Use the record to understand how life choices are affecting you. If blood pressure readings are consistently high, see a doctor. Symptoms may or may not be present. The body is not designed to withstand high blood pressure values. The heart will work harder to push blood through stiff and non-compliant blood vessels in hypertension. The result, like any muscle being worked, is enlargement of the heart. However, unlike biceps, the heart's function will be impaired as it enlarges. Also, high pressures will lead to shear forces tearing the intimal lining, inner surface, of blood vessels. This is the type of damage that triggers strokes, heart attacks and dissecting aortic aneurysms, a dilating then tearing of the main, largest artery. The blood pressure at its worst, is the number apt to do the harm. What is measured at random moments is only a glimpse of how we are when other situations occur. So, when blood pressure is high, even temporarily, it places vulnerable blood vessels at risk of damage. Small vessels in the eye and kidneys getting damaged lead to two of the more common consequences from hypertension: retinopathy and nephropathy. Your question, is a blood pressure of 160/90 high? Is yes. It should be a wake-up alarm to investigating your health. Hypertension is a silent killer. It is one of the leading risk factors, if not the most important risk for cardiovascular disease. Even more than weight, cholesterol and smoking. Answer by Priya. Blood pressure is categorized as follows: normal, less than 120/80ths of a millimeter. Hg. Prehypertension, 120/80 to 139/89ths of a millimeter. Hg. Stage 1 hypertension, 140/90 to 159/99ths of a millimeter. Hg. Stage 2 hypertension, 160/100ths of a millimeter. Hg and above. Had a blood pressure reading of 160/100ths means readings between 160/110 and 180/110 usually indicate stage 2 hypertension, which puts you at high risk for life-threatening problems such as heart attack and stroke. Answer by Roy Gillen. In 2017, new hypertension guidelines were published by the AHA/ACC. The new guidelines lower the threshold for diagnosing hypertension. The rationale, or logic, is that complications such as strokes and heart attacks occur at lower values. Normal blood pressure is now considered less than 120/80ths of a millimeter. Hg. Elevated blood pressure is systolic, top value, between 120 to 129 and diastolic less than 80. Higher systolic or diastolic values are considered hypertension. Remember that clinical diagnosis of hypertension should be made by a healthcare professional. I recommend that you discuss the topic with your physician, as hypertension is a major risk factor for strokes and heart attacks. Medical disclaimer: the comment contains general medical information. Do not use the information as medical advice. The information is not a substitute for medical advice. No warranties or representations are given in relation to the medical information. Please consult your physician if you have any questions about any medical matter. For the full article, use our app, My BP Blood Pressure Log. Click here to check it out.